I'm Emma. I'm one of the senior diabetes and endocrinology dietitians here at the Royal Melbourne. Lifestyle management is one of the first line approaches for managing type 2 diabetes. So what that means is making sure someone's following a healthy, nutritious diet, making sure that they're exercising, and making sure that if needed, they do reduce their body weight. The main messages are to really reduce intake of discretionary foods. So that's things like takeaway foods, processed foods, what people would see as junk foods, biscuits, chips, chocolates, lollies, soft drinks, all those types of things. So reducing them as much as possible is sort of a really good starting point. Making sure that people include lots of fresh fruit and vegetables, whole grains, lean meats, fish, chicken, nuts and seeds, good quality dairy foods, and making sure that people are getting in the good stuff and really trying to cut back on some of those other foods.
Typically, most people would these days commence on medication, usually immediately, and the classical medication that's commenced is metformin. Essentially, it suppresses excessive glucose production by the liver. Then there's another generation of medications which have been around for a long time called sulfonylureas, and they address the issue of deficient insulin production by the pancreas. And of course, there's always been insulin therapy for the last 100 years. It's just over 100 years since insulin was discovered as a therapy for diabetes, and insulin is obviously very effective at giving a signal to shift glucose from blood vessels to be used into tissues for energy. So people who have more advanced forms of type 2 diabetes often end up on insulin, and that may be 10 or 20 years post-diagnosis.
Here at the Royal Melbourne Hospital, we have a really large diabetic foot unit. You would come and see us if you needed to go to emergency for an infected or worsening diabetic foot ulcer, and then you needed to be admitted here. We have both an inpatient and an outpatient service. And so you would see us also in the outpatients clinic if you needed multidisciplinary care. So not just podiatry for wound management, but you needed orthotists for footwear and devices. You still need an endocrinologist for diabetes management, and you still might need services to the vascular surgeon or orthopedic surgeons, and we have clinical psychology and care coordination. So we have a wonderful array of resources here for those people that really need all the care for these really serious conditions.
Hi, I'm Lois, the diabetes nurse practitioner here at Royal Melbourne Hospital, and today I'm just talking about continuous glucose monitoring. Continuous glucose monitoring involves wearing a sensor on some part of your body, normally in some fatty tissue, and this particular one has a reader. Other continuous glucose monitoring sensors go to your phone. You get a reading about every minute, which gets averaged out to every 5 minutes, so that's 288 blood glucose readings per day. You can get alerts when your levels are too high and too low. You can have followers, and they also get the alerts when you're too low or too high. This particular one gets changed every 2 weeks. You can swim with them, you can shower with them, you can go for a run with them. Some people don't like being attached to something 24 hours a day, but if it means you can get back to being at work and doing your normal activity, these are fantastic.
There's a landmark study which was published again approximately 20 years or so ago called the Diabetes Prevention Program that showed that in people who had pre-diabetes, people at risk of developing diabetes, lifestyle intervention in the form of regular exercise, 5 sessions per week for 30 minutes with nutritional counselling, reduced their risk of progressing to diabetes by 60%. And that was twice as good as being treated with metformin, a medication which is usually used in established type 2 diabetes, where the reduction in progression diabetes was 30%.
Diabetes can affect anyone, but living a really healthy lifestyle with maintaining, what would be a healthy weight for an individual, eating good quality foods, maintaining exercise levels, they're all the things that will help to prevent type 2 diabetes from occurring.
If you've just been diagnosed with type 2 diabetes, the first message I have for you is don't panic. There are plenty of very good treatments for this condition. And in fact, there even are some forms of diabetes which are reversible. The advice you'd want to seek is that from multidisciplinary health professionals. We're talking about advice in relation to eating as well as possible, and that would be seeking the opinion of a dietitian. We're talking about advice from people like exercise physiologists who discuss tailored exercise programs. We're talking about advice from nurses who train people on how to perform glucose monitoring. And we're talking about advice obviously from medical practitioners, primary healthcare teams, general practitioners, but of course there are specialist endocrinologists who are there to assist. And the medications are really very prolific. There are now 10 different medication classes for diabetes, so there's a whole different array of treatments available. Many of these new generation medications are actually promoting not only lowering of blood glucose, but marked weight loss. And so I think the prospects for people with diabetes who are diagnosed these days are really much more promising. And I think there's lots of discussion about placing diabetes into remission in the future.